Canadians living with obesity aren't getting the medical help they need in Canada. That's according to a new report that claims the condition just isn't being treated like other chronic illnesses.
We have traditionally looked at obesity largely as a matter of personal responsibility. So you've kind of done this to yourself, and so you need to find your own solutions. And here's what, so doctors will tell people to go lose weight, but they won't actually see it as their job to help them, get the treatment. That's not how you would respond to someone who has diabetes. But obesity, unfortunately, that's what very often happens.
The Canadian Medical Association officially recognized obesity as a chronic disease back in 2015, but a study released by the Canadian Obesity Network finds that public health systems and private benefit plans aren't providing the treatments needed for patients.
There's a dietitian, maybe an exercise person, maybe a psychologist, people who are actually qualified to treat obesity. We have almost none of those programs. The few programs we have across Canada are generally attached to those surgical programs, again, where there's a long way to get in. So for the average Canadian who's really looking for help with this disease, there's not a lot of access.
The report makes 7 recommendations, including that all employers and provinces start recognizing and treating obesity as a chronic disease. Ontario's health minister says the province is already making significant strides.
We invest about, on average, I think about $40 million a year, each year over the last 10 years in anti-obesity measures, if I can describe them that way, including we've got I think 12 regional centers for bariatric surgery, which is surgery specific to individuals with obesity.
Hoskins also pointed to non-medical moves his government has made to battle obesity, including forcing restaurants to list calorie information on menus.